Welcome to this segment of our learning series on health equity basics. This program is brought to you by our regional chronic disease collaborative partners in Alaska, Hawaii, Montana, and Wyoming. This segment will cover some of the common terms and definitions associated with health equity. Health equity is the attainment of the highest level of health for all people, regardless of race, ethnicity, sexual orientation, socioeconomic status, and other factors. Sometimes the terms health disparity and health inequity are used interchangeably, but there is a subtle difference in the definitions. Health disparities are differences in health status among distinct segments of the population. Based on information from the CDC, women in the U.S. tend to live longer than men. This is an example of a health disparity. These disparities can be caused by many different factors. Health inequity means that health disparities are a result of systemic, avoidable, and unjust social and economic policies and practices. Health inequities are responsible for many of the health disparities that can affect historically marginalized people or disadvantaged communities. Healthcare disparities are differences in access to or availability of medical facilities and services, and variation in rates of disease occurrence and disabilities between population groups. Equality means that each individual or group is given the same resources or opportunities. They are treated equally or the same. Equity recognizes that in order to reach equal outcomes, each person may need different or unique resources or services. This image helps illustrate the difference between equality and equity. Equality is making sure everyone gets the same resource or access to resource to address a problem. It can work if everyone starts from the same place or situation. In this image, the ladder or access is equal, but the outcomes are not. Equity, on the other hand, seeks to address a problem or inequity by customizing the level and types of resources provided based on unique needs. Equitable strategies may need to be unequal in order to ensure sufficiently similar opportunities for individuals and communities to achieve their full health potential. Diversity is any dimension that can be used to differentiate groups and people from one another, included but not limited to national origin, language, race, color, disability, ethnicity, gender, age, or religion. Equity is where everyone is treated according to their diverse needs. Inclusion is the state of being valued, respected, and supported. It means considering every individual's needs and recognizing their uniqueness. When we treat people equitably, we are being inclusive, allowing everyone to participate. Health equity is the goal of helping each person attain their highest level of health, while diversity, equity, and inclusion programs and practices focus on appreciating each person's uniqueness. DEI initiatives can help lead to increasing health equity because they promote representation and acceptance. The concepts of equity, diversity, and inclusion work together and reinforce each other. Social determinants of health are the non-medical factors that influence health outcomes. They are the conditions in which we are born, grow, work, live, and age, and the wider set of forces and systems shaping the conditions of daily life. The term health-related social needs is sometimes used interchangeably with the term social determinants of health, but an important distinction can be made. Health-related social needs refers to the social and economic needs that individuals experience and that affect their ability to maintain their health and well-being. These health-related social needs are a result of their community's underlying social determinants of health. Health outcomes are the measurable results of an individual's health attributed to an intervention on a person's life. Culture refers to all the ways of life that are passed down from generation to generation among a certain population. Our culture might be reflected in our morals, customs, value systems, and spiritual traditions, and even in what we eat and how we dress. When addressing health equity, it is important to acknowledge different cultures' beliefs to better address everyone's needs. Bias is prejudice in favor of or against one thing, person, or group compared with another. When working to advance health equity, knowing and addressing our biases will help us identify and promote fair and unprejudiced behavior and practices. These are just some of the common terms associated with health and health equity. The next segment will cover some of the factors that help determine our health.